Hey guys, Dr. Ryan here. I wanted to explain shoulder injuries and how we go about them to help people heal a lot of their shoulder injuries, and they don't necessarily always know we do shoulders and extremities here at RH Spinal Care. But it's a big part of injuries that I care for, and I'm going to explain to you the foundational reasons why chiropractic care and extremity care can really help heal shoulder injuries. So let's dig in. Most people think with shoulder injuries that there's a shoulder problem, which of course there might be a shoulder problem. But I've found that 85%, think about that, probably 85% or more of shoulder injuries have an issue that starts in their neck. Think about a dog. If you step on a dog's tail, it doesn't bark out its tail, it barks out its mouth. And oftentimes what's happening is people are having shoulder dysfunction. The bark is here and the step on the tail is right here in the neck. And I'm going to show you some visual that will help you see this. Here's a head and the neck, and here's nerves that come out of your neck and supply all your shoulder muscles. And if you remember and know, the shoulder is mostly rotator cuff muscles holding your shoulder together. And it's wrapping around that bone and holding it in there, giving it stability, giving you strength. And that joint being in the proper part of your shoulder is what allows normal mobility. So when you have shoulder issues, you might think I have pain or I have stiffness or muscle tightness, that sort of thing. And you're thinking it's directly that. But 85% or more of the time, there is a neck dysfunction issue where the vertebra in the neck are misaligned, creating nerve impingement that is creating muscle tightness in the shoulder, muscle weakness in the shoulder, pain, which all those things, inflammation, they lead to shoulder dysfunction, meaning your mobility might be different as well. You might not be able to move it fully. So oftentimes we can fix a lot of shoulder cases with simply looking at the spine first, making sure there's no dysfunction there, clearing that out. Oftentimes just doing that alone will fix a high percentage of shoulder pain and dysfunction. The second step is we do check the shoulder itself. We want to feel the muscles around the shoulder, see if those aren't pulling on the spine and creating their own problems. So we want to make sure those are good and clear, getting that worked on. There's a lot of muscles in here. So whether you do it at a massage therapist, physical therapist, or a chiropractor like myself can get into those things and figure out the muscle issues going on in there. That usually requires some help. You can try and work on these things on your own with a tennis ball or one of those massage muscle trigger point canes. But oftentimes it takes someone to help get into the root, starting with the neck nerves and spine, working your way into the muscles. The third thing we're going to look at is the dysfunction itself in the shoulder. How is that shoulder joint and your humerus positioned in the shoulder joint itself? That needs to be good, because if the shoulder's pulled out like this and you go to raise your arm up, it's not gliding into the joint. So normally this joint will just smoothly glide in here if it's aligned well. Sometimes we have to adjust the shoulder to get it unstuck here, misaligned here, back into its place. And that's a really gentle adjustment that usually takes place and feels amazing when you need it. And this subluxation that I'm referring to, that's not the same thing as a dislocated shoulder. I dislocated my shoulder in hockey one time a year or two ago. I went to a physical therapist to help me rehab the shoulder because I tore some things. And so there are certain shoulder issues where, like a dislocated shoulder, you do want to go seek professional help for that. And physical therapists do a great job. Chiropractors, some might be trained in that. I wanted extra help for myself. And a dislocated shoulder is a lot different than a frozen shoulder. Oftentimes, when neck dysfunction is occurring and nerve impingements occurring over time, you're creating muscle tightness, which eventually leads to muscle weakness. And the shoulder dysfunction stays there so long, and you usually have these subluxations that occur as well with that. A domino effect is happening. And the shoulder freezes up, where you can no longer even move it that much in any sort of direction. We call that frozen shoulder. And there's tons of inflammation in there. And we go about these similarly, but every body's unique and every injury is unique. We may even recommend cold laser therapy or light laser therapy to just kill down and cut down that inflammation and those scar tissue adhesions that have built up. But the instability is the last element I want to talk about here. Because if you've had shoulder issues for an extended period of time, weakness, tightness, nerve, they call it cervical brachial syndrome, where the nerves in your neck are creating issues down your arm or into your shoulder. This leads to instability in the shoulder, meaning those muscles are not strong enough anymore at the moment to hold that shoulder into its socket properly, so it's sloppy around in there, creating joint dysfunction, joint disease in the shoulder itself. That shoulder stability requires strengthening that and working on stability exercise for that. Most often you'll get those from a physical therapist. I will work on creating a resource library for all my clients and everyone that wants to access that on my website. We're working on that now to give you just simple step 1, step 2, step 3. How do I work on stabilizing my shoulder? And now this is after you've made sure your neck nerves are good, your neck spinal care is good, your shoulder joint function is good, and your body's ready to do these stability exercises. So look for that on either the YouTube channel or the website as a resource for you, and let me know if you have questions. I hope this video helps you get a good picture of how we care for shoulders and help restore health to a shoulder. Have a great day.